CT stands for computed tomography. It's an advantage that has great bone detail, okay? Disadvantage is that it's a lot of radiation, actually. It's like 100 x-rays at once because of the way that the CT scan works. Now, if you look at this machine, so you guys understand that, do you guys know how a CT scan works? Has anybody ever gone over that as far as the actual technology? This tube or this donut that they go into, okay, both of these here, what there is in there is actually just an x-ray machine, okay? And that x-ray machine is on a wheel that goes around the patient. And what the machine does, it spins that x-ray machine around the patient's body while they're sitting in there, taking multiple x-rays from every different direction. Then the sensor that's on the other side of the x-ray, so this thing is spinning around like this, it keeps going around, where you have an emitter and a receiver over here as far as the x-rays, and then those signals of the radiation that gets picked up by the receiver gets sent to a computer. The computer then picks up the different densities and how much density there is on these different x-rays. And why that's important is if you take an x-ray through a spine, well, you're taking an x-ray just like you see here on this previous image, okay? There's bone here, there's no bone here, okay? There's no bone here. When that x-ray is taken, now it changes a few degrees, takes another x-ray. Well, there's still going to be no bone here, and these bones are going to be taken at a different angle. Well, the computer interprets that and gives you a very clear picture of the bones with much more detail because it's many, many, many x-rays taken at one time, and the computer puts all that information together and generates an image for you. Okay, and you'll see what that looks like. Here's a CT scan. And then, in addition to that part I forgot to tell you, is it works like a bread slicer. So there's a vertical slices it's taking through you and then horizontal slices through you so you can get better details as far as looking at those fine cuts. So now you can see it, you can clearly see the bones very, very clear. They're not this hazy whitish fog that you see on an x-ray. You can actually make the actual distinct borders out. Obviously there's a big problem right here. But those are spinous processes that I showed you in the back, okay? You can make out a little bit of the soft tissue. This is the spinal canal, okay, through here. The spinal nerve roots are in here. Spinal cord ends right about here, okay? And then the disc spaces, you still get just kind of an idea that there's some stuff in there, but you really can't get a clear actual image of what's compared to what. Like, where does this disc space end? Well, it's there, back here. It's not here. It should be ending right here, so it's not as clear to look at the soft tissues, but it does give you a very clear look at the bone. This is a cross-section of this fracture. So this is this piece of bone that's shifted or pushed back into the canal. That's where it is inside the canal. This should be an open hole. Okay, so that's what's called a burst fracture because it's usually a compression fracture or compression force that bursts the bone. And so the part that's really worrisome is the part that goes posteriorly into the canal where the nerve roots are. Okay, so that's CT scan. All right.